Breaking news for 75 million Americans. Your Social Security check is about to get bigger in 2026, and I'm about to show you exactly how much money you're getting and when it's hitting your account. This is not speculation. This is official. The Social Security Administration just confirmed a 2.8% cost of living adjustment for 2026, and if you're receiving Social Security, SSDI, SSI, or Veteran VA benefits, you need to understand how this affects your actual monthly income. Here's what most people don't realize. The increase is different depending on which program you're on, and the payment dates are not the same for everyone. If you're on regular Social Security or SSDI, your first increased payment comes in January 2026. But if you're receiving SSI, you're actually getting paid earlier, December 31st, 2025. And if you're a veteran getting VA disability benefits, you've got your own separate COLA increase coming on the same day. That means some of you could be looking at hundreds of dollars in extra payments hitting your account in just the next couple weeks. The average Social Security retirement benefit is increasing by about $56 per month, but your number could be significantly higher or lower depending on your current benefit amount. And here's the part nobody talks about. Understand how this 2.8% increase actually translates to real dollars in your pocket, because the math matters. We're also breaking down exactly which payment schedule you're on based on your birth date, so you know precisely when to expect your money, and we're showing you how this increase compares to previous years. If you want the complete breakdown of your 2026 benefit increase and exact payment dates, hit that like button right now. This information could literally put hundreds of dollars in perspective for your next year. Okay, so we just confirmed it officially. The Social Security Administration released the 2026 cost of living adjustment numbers, and they're even better than what most people were expecting. But here's the thing. Knowing you're getting an increase and actually understanding how that increase is going to show up in your bank account on specific dates are two totally different things. And that's exactly what we're breaking down today, because if you're receiving any type of Social Security benefits, SSI, SSDI, or VA disability benefits, this increase is already calculated and ready to hit your account. You just need to know when and how much. Let's start with the actual numbers because this is where it gets real. The Social Security Administration announced in October that beneficiaries across all programs, that's 75 million Americans, are getting a 2.8% increase for 2026. Now, 2.8% might sound like a small number when you're just hearing it as a percentage, but let's talk about what that actually means in your pocket. The average Social Security retirement benefit is currently sitting at around $2,015 per month. With the 2.8% increase, that's going up to approximately $2,071 per month. That's about $56 more per month that you're going to be receiving. Now, that's the average. Your number could be higher or lower depending on your current benefit amount. If you're getting $2,500 a month right now, multiply that by 2.8% and you're looking at about $70 extra per month. If you're getting $1,500 a month, you're looking at roughly $42 more. The math is straightforward. Take your current monthly benefit and multiply it by 0.028, and that's your increase. But the increase isn't just for retirement benefits. This 2.8% applies across the entire Social Security system. If you're receiving SSDI, that's Social Security Disability Insurance, your benefit is going up by the same 2.8%. Same thing if you're on survivor's benefits because someone in your family who was covered by Social Security passed away. Family benefits are increasing. Spousal benefits are increasing. Every single type of Social Security benefit is getting this boost. And if you're receiving SSI, which is Supplemental Security Income, that's increasing too. SSI is different from regular Social Security. It's a needs-based program that provides monthly assistance to older adults with limited income and to people who are blind or living with disabilities. But the COLA increase applies to SSI as well. Now, here's the critical part that most people get confused about, when these increases actually start hitting your account. This is where timing matters, and you need to pay very close attention because the dates are different depending on which program you're on. If you're on regular Social Security or SSDI, your first increased payment arrives in January 2026, but the exact date in January depends on your birthday. This is the same payment schedule system that's been in place for years, based on when you were born. If you were born between the 1st and 10th of any month, you're a second Wednesday person. For January 2026, that means your increased payment comes on Wednesday, January 14th. If you were born between the 11th and 20th of any month, you get paid on the third Wednesday. That's Wednesday, January 21st in January 2026. And if you were born between the 21st and 31st of any month, you're a fourth Wednesday person, getting paid on Wednesday, January 28th. But here's where it gets interesting. If you're receiving SSI, Supplemental Security Income, you're not waiting until January like regular Social Security beneficiaries. You're actually getting your increase earlier, much earlier. Since January 1st, 2026 is a federal holiday, that's New Year's Day, the Social Security Administration moved your SSI payment forward to Wednesday, December 31st, 2025. That means SSI recipients are seeing their increased payments hit before the calendar even flips to 2026. You could literally be looking at more money in your account on New Year's Eve. This is significant because while Social Security beneficiaries wait until mid to late January, SSI folks are getting the boost in December. And here's another thing about SSI that catches people off guard. That early payment on December 31st is your January payment. It's not extra money. It's your January benefit getting paid early because of the holiday. So when January 1st comes around, you won't be getting another SSI payment because you already got your January check on December 31st. Now let's talk about SSDI separately for a second, because some people on disability have a different schedule than regular retirement beneficiaries. SSDI, Social Security Disability Insurance, follows the same Wednesday payment schedule as regular Social Security based on your birthday. So if you're on SSDI and you were born on the 25th of any month, you get your increased SSDI payment on January 28th, 2026, just like you would if you were on regular retirement benefits. The increase applies the same way. The payment dates are the same. The only difference between regular Social Security and SSDI is who qualifies and how you get on the program. But once you're receiving either one, the payment schedule and the COLA increase work identically. Let's talk about something that a lot of people don't realize. If you're receiving both Social Security and SSI at the same time, you actually have two separate payment dates. This is confusing for a lot of people, but it's how the system works. Your Social Security payment comes on your assigned Wednesday. Your SSI payment comes on the 1st of the month or December 31st in this case because of the holiday. That means if you're one of these dual beneficiaries, you're getting payments on different dates. You might get your Social Security on January 21st and your SSI on December 31st. Or you might get SSI on December 31st and your Social Security on January 14th. Whatever your specific birth date is determines your specific dates. Here's something that's really important to understand about how the Social Security Administration communicates this to you. They're sending out COLA notices starting in early December 2025. If you're receiving benefits, you're going to get a piece of mail or an online message if you have a My Social Security account that tells you exactly what your new benefit amount is going to be in 2026. This notice is going to have your exact dollar amount increase spelled out. Don't throw this away. This is official notification of your new benefit. Save it. And if you have any questions or anything looks wrong, you can reference this notice. The Social Security Administration is also making it easier for people to see this notice online. If you create a My Social Security account by November 19, 2025, you can view your COLA notice digitally instead of waiting for a piece of paper in the mail. You can even set up text or email alerts to notify you when the message arrives. This is actually a smart move because digital notices are instant and you don't have to worry about mail delays. Now let's address something that's on a lot of people's minds: Medicare. If you're on Social Security and you're enrolled in Medicare, the increase you're getting might be partially offset by Medicare premium increases. The Medicare Part B premium, that's the insurance that covers doctor visits and outpatient care, is going up to $202.90 per month starting in January 2026. That's up from $185 per month in 2025. That's almost an $18 increase. So while you're getting a $56 increase to your Social Security on average, Medicare is taking back about $18 of that if you're on Part B. That still leaves you with about $38 extra per month, but it's important to understand that the increase doesn't translate dollar for dollar into more money in your pocket because of Medicare deductions. Let's talk about VA benefits for a second, because if you're a veteran receiving VA disability benefits, you've got your own COLA increase coming too. The VA announced that veteran disability benefits are also getting a 2.8% increase starting in January 2026. So if you're a veteran getting both VA disability and Social Security, and yes, that's possible, you're getting an increase from both programs. These are separate increases from two different agencies. Your VA benefits go up 2.8% in January. Your Social Security goes up 2.8% in January. They're not combined or anything like that. They're just two separate increases happening at the same time. Now, I want to talk about something practical that you need to do right now before January gets here. If you haven't created a My Social Security account yet, seriously, create one today. Go to ssa.gov and set up your account. It takes maybe 10 minutes, and it gives you access to so much information about your benefits. You can see your complete earnings history. You can verify your payment schedule. You can see your COLA notice online. You can request a replacement Social Security card. You can check the status of any claims you filed, and you can set up alerts so you know immediately when something important happens with your account. This is not something that should take a back seat. If there's an error in your Social Security account, the sooner you catch it and correct it, the better. Don't wait until you don't get a payment to realize there was a problem. Here's another important thing. If you live outside the United States and you're receiving Social Security, your payment schedule might be different. Some countries have different banking systems and mail services, so the Social Security Administration sometimes adjusts payment dates for international beneficiaries. If you're living outside the US, you need to check with the Social Security Administration directly about your specific payment date to make sure you're expecting your money on the right day. Let me also address something that comes up a lot. What if you're still working while you're receiving Social Security? There's an earnings test that applies to beneficiaries who haven't reached full retirement age yet. If you're receiving retirement, survivor, or family benefits before you reach full retirement age, and you continue working, the Social Security Administration reduces your benefits if your earnings exceed a certain threshold. In 2026, that threshold is $24,480 in earned income. If you make more than that, Social Security withholds $1 for every $2 you earn above that limit. So if you earn $40,000 in 2026 and you haven't reached full retirement age yet, your benefits would be reduced by $7,760 for the year. Once you reach full retirement age, the earnings test goes away and you can earn as much as you want without affecting your benefits. This is important to understand if you're still working while drawing Social Security. Let's talk about verification one more time, because this is critical. Before January comes, verify that the Social Security Administration has the correct banking information on file for you. If you moved and changed banks, or if you closed an old account and opened a new one, you need to make sure your direct deposit information is current. If the wrong account is on file, your payment will still go somewhere, but it might not be your current account. You can update your banking information through your My Social Security account, or you can call the Social Security Administration at 1-800-772-1213. This is a free call, and Social Security employees are available during business hours to help you. Don't let confusion about your banking information cost you access to money you're supposed to receive. Here's my final piece of advice as we head into 2026. Take the time to understand your specific payment schedule. Write down the exact date your increased payment is coming. Set a reminder in your phone for that date so you can verify it hit your account. If it doesn't arrive within a day or two of the expected date, reach out immediately. Don't assume it's coming late. Investigate. The Social Security Administration processes millions of payments every month, and errors do happen occasionally. But they also fix them quickly when you bring them to their attention. You've worked hard for these benefits. You've paid into the system throughout your working life. Make sure you're receiving every penny you're entitled to, and make sure you understand exactly when you should expect it. The 2.8% increase is real. The January dates are set. Now it's just about making sure you're in the right position to receive what's yours.